Students, yesterday NBE released the application forms. So today exactly 14th March I am talking. So the application opens by 3 p.m. right? So in this particular video, I am going to talk about what are the take-home message. It is actually the booklet of 121 page. So I'm going to talk about what are the important points which you should consider before you go for the application part, right? So probably it will take 15 to 20 minutes. The whole 121 page, I'm just to simplify and given to you students. So right. So let's go for what are the cutoff dates for each process. So the application opens by today by 14. So till 30, the application opens, right? Exactly 11:55 it is closed. And between the April 4 to 6, you have the general edit window. You can be able to edit. So important criterias, like for example, suppose if you wanted to change your marks, or suppose if you wanted to change your status of PWD, you can able to change. Between the April 21 to 22, suppose your image or thumbprint or signature, if it is an incorrect and if it needs some correction, NBE will give some instruction to your mail ID. So you have to go through the correction between the edit window, April 21 to 22 students. And the admit card is released on April 29 and the 2nd May, your exam, right? And obviously the very, very important cutoff date, which is given there here, if you are an intern, you should able to complete your internship by May 31st. That is very important. The interns who are completing even June 1st is not eligible for this year NEET MDS exam. Very important. And obviously June 2, exactly 1 month from your exam date, your declaration of the result happens. All the best here, right? So yes, what are the 3 baseline eligibility criteria to apply for your NEET MDS application, students? So criteria 1, so you have to be complete your BDS degree and you should complete your registration process, either temporary or permanent. And yes, the third one, your CRRI 12 months CRRI period should complete by May 31st to 2026. The 3 basic criteria for your application. Yes. So what are the 5-step registration process, students? So number 1, you have to create a user ID and password. Yes, number 1. Once you create your user ID and password, so go for the second step. You have to upload all the recent photographs, thumbprint, signature, everything. And you have to go for the select the city, exam city, test city, whether it is Chennai or Coimbatore, whatever, Trivandrum, whatever you have to do the selection. And the fourth one is pay the fees. So 3,500 for the general OBC and EWS category. 2,500 is for SC, ST and person with a disability. So once you paid the fees, then you have to submit the process. Once you submit the process, we will get something like an yes. If it is an yes, you got successful application, right? So this is a very important 5-step process, easy process. But here, very important part. So what are the things you can able to edit? What are the things you cannot able to edit? So your name cannot edit. Email ID, mobile number, test city, Aadhaar number cannot be edited. Once you submitted your application forms, what are the things can be edited? Between the edit window happening between 4 to 6, I am talking, right? So date of birth can be edited, category, which category you belongs to, PWD, academic details, so mean marks, first year, second year, third year, final year marks, everything you can able to edit between the window happening between 4 to 6 students, right? Yes, so this is for example. These are the exam cities. Just I'm taken only for the Tamil Nadu. So for Tamil Nadu, there are 6 centers, like Chennai, Coimbatore, Madurai. For each state, they will be given some center. So if we belongs to Kerala or Karnataka, whatever, so these exam cities are given. So based upon your nearby place, you can select, right, students? Coming to the exam architecture, how many questions from which subject, right? For example, part A, which is the basic science, like anatomy, physiology, biochemistry, path, micro, general medicine, general surgery, will together 100 MCQs and the time period is 75 minutes. Part B is clinical science, almost close to the 140 questions, 105 minutes. All the clinical subjects, including your dental materials, belongs to the Part B students. So totally 3 hours. Language is English. Hopefully you know, right? So coming to what is a blueprint which is given by the National Board of Examination? Almost closely equal marks to from anatomy to the general surgery, 14 marks, except general medicine and general surgery, it is a 15. This is a blueprint which is given by National Board of Examination. And if you ask him whether they follow really this blueprint, mostly no. There are some variation. Okay, from the dental materials to the public health dentistry, again equal marks. The total question number is 240, 3 hours, right? And coming to the scoring balance, okay, mean if you get a correct answer, what is your score? +4. And if you have a negative marks, -1. If you not attended, 0, right? So most of the students know this. What is the exam day chronology? On the day of examination, what are the important time you should consider? This registration process or entry process starts by 12 o'clock and the gate is closed by 1:30. Even if you go to 1:31, they won't allow you students. This is important instruction which is given in your NEET MDS booklet format. Okay, and 1:45, once you enter into the exam hall, so your login access will be granted. Okay, and you can able to read all the instruction from 1:40. Your exam starts by 2 o'clock, completed by 5 o'clock. The entire year preparation you have to be right in 3 hours, the very important time period. Okay, whatever you studied, okay, you have to apply your lateral thinking. Okay, so usually I use students that you have 48 days from here onwards. So these all the 48 days, your brain should be very active. Between the time period of 2 to 3 hours, you should take a little smaller lunch. Make sure you write or given the particular time for writing the mock test. So once you write the mock test on specific particular time, your brain will be very active and you have to train your brain. So that is most important thing I consider students. So don't sleep for the next 47 days because it's an afternoon. The heat is over, right? Obviously we feel sleep, but you have to overcome across that. You have to be what? You have to be train your brain. That is very important apart from your preparation. Yes, students, what are the items mean which you can need it? What is not allowed inside the exam hall? Obviously, your Aadhaar card with the photo, students. Without photo, Aadhaar card, they won't be allowed. Maybe, actually, once I know, so one of my student, actually, he got the Aadhaar card. The small part of the Aadhaar card without photo, actually, they're not allowed. The 1 year of preparation is vanished. So make sure the Aadhaar card which has the photo, okay? And this, all the valid photo, ID card, whatever you have, okay, driving license, okay, PAN card, everything. And specifically, they are asking color admit card. Obviously, all the electronic items, stationery, ornament, which is not allowed. Yes, yes. And suppose if you have an Aadhaar card in your phone, usually I won't allow. Okay, I won't prefer the students should have the Aadhaar card in the phone. Okay, and if you have in the phone, make sure your Aadhaar is unlocked. Okay, sometimes it may locked. Again, it create a problem, right? Yes, students, what are the criteria for the disqualification? So suppose if you have do any one of things, so there is a high chances problem of the disqualified in your NEET MDS exam. Okay, so what is the important thing I consider here is this is the one time. Okay, even if you enter 1:31, you will be disqualified. You won't be enter into the exam hall, right? And the biometric if it doesn't work, the Aadhaar card details not mismatching, and if the exam paper is leaking, right? And if you taken the old photograph more than 3 months, okay, and the photograph which you given in the application form and the real person photos or faces doesn't match, it actually happens once. Does it match? They won't allow you. Okay. Yes, these are the criteria for the disqualification. The percentile for each category, general, unreserved, SC and ST category, it is a 40th percentile. The minimum percentile for the eligibility. Right. Suppose a person, the two persons, if got a same mark, who will getting the higher rank? Okay, top rank. So that is called as tiebreaker. The tiebreaker based upon this is the first one they will see is number 1. Okay, who got overall incorrect answer, wrong answer less, they will be getting the top rank. Okay, yes. So, but suppose in case, very rare condition, both will be the same, incorrect response, then they will go for the second criteria. Whoever scored higher score in the part B, that is clinicals, they will be considered as a top, even if it is a tie, very rare, very rare. Then go for the third, okay, less incorrect answer. Fourth one, okay, who got the highest mark in the examination, BDS examination. The last one is the date of birth. Whoever is the oldest, they will be given the highest priority, right? Yes, students. So this is usually the examination conducted by NBEMS. And so this will give the details to the MCC and the state authorities. So state authorities based upon they have, suppose in case they have a rural posting benefit. So they will be based upon that, they will be creating ranks. Students, very, very importantly, so usually the students will have doing some mistakes in doing the signature. Okay, number one, thumbprints. Okay, yes, students, just a minute. Okay, and photographs. So this is the three important things which you should need. Okay, so usually students will make mistake here. Right, let's go for what are the important things. I've just a simplified version, right, students? So coming to the, yes, when you go for a photograph, yes. Right. So basically the photos have this dimension, which is the length is 45 into 35, and 70 to 80% of the photograph should have occupied by the head, and preferably, not preferably, okay, they say your background should be white. Okay, so it should not be selfie. The studio photograph is preferable one. Okay, and so there will be some instruction like the photograph should not be like this. Okay, so probably if there is a background interface or improper framing or facial abstraction like a goggles, okay, unprofessional. So these are shadowing, which doesn't allow, okay. And again, your signature is mostly, okay, sometimes you will be getting in your one more option. Suppose if you made a mistake, they will be given one more option, okay, between 21 and 22 of April. So can able to correct in case if you made a mistake in your signature or photograph or thumbprint. But better what I say, when you're doing the first attempt itself, make sure you're given the correct sizes. Right? For example, the size should be 1.5 centimeter into 3.5 centimeter. Create a box and inside you have to create your signature. Yes, you have to scan it. Okay, and you have to be cut down. And so this is the, you should not do all those things. Right? And again, the thumbprint students, you have to create a box of 1.5 into 3.5. The color is very important, either blue or black. Black is preferable, right? Yes, students. So these are the important things which we just given, right? So obviously should not be smudged out or incomplete print. So the acceptable print will be like this, right? So basically, what is the final take-home message for all the three? Like photograph, signature, thumb impression. So given. So if you want, you can take a screenshot, students. Very simplified version, right? So everything should be, file size should be for all the three should have less than 80 KB, right? Number one. Number two, format is JPEG. And the sizes is variable. So you have to create a box for your signature and thumb impression. Yes. The color, students, blue or black color. The other colors usually not accepted. Make sure that you should not have green color or red color. Yes, students. Okay. Yes. So this is all about all the important points which you should know before you go for the application, right? Yes, students. Yeah. So make sure you follow all the instructions. So all the 121 pages, whatever given, what is important, I just simplified in this and this was just given to you. Okay. Yes, do well and all the best. Okay.